Position 1. The first provider makes contact with the patient. This can be any provider regardless of what apparatus they're assigned to. They're going to perform the initial assessment and check for a pulse while evaluating the patient's breathing. They'll want to expose the patient's chest and begin CPR. Remember, we want to do 200 chest compressions. Position 2. Turns on the monitor and places the pads on the patient's chest. They'll place the monitor in AED mode. Position 2 is responsible for making sure that no one is touching the patient if the AED advises that a shock is to be delivered. Remember, if a shock is advised, we want to continue chest compressions while the monitor is charging. Position 2 will alternate chest compressions with Position 1. Position 3. This position will open and clear the airway and place simple airway adjunct, like an OPA or an NPA. Position 3 will apply the end-tidal CO2 nasal cannula. They will also apply the non-rebreather mask with 15 liters per minute of oxygen until an advanced airway can be placed. Position 4. This position will oversee the code and has team lead duties. Their responsibility will primarily be documentation of all the interventions that are done and keeping the times of those interventions. Position 5. This should be an ALS provider position. Their primary responsibilities will be to establish IV or IO access. They will be responsible for administering all medications and will initiate at least a 500 cc fluid bolus. Position 6. This too should be an ALS provider position. Their responsibility will be to operate the monitor and will take the monitor out of AED mode. To take the monitor out of AED mode, press the lead button. This position will take over the team lead role and will make the patient treatment decisions.